Well, I'm excited for this conversation today. I have to tell you that this particular guest is going to add so much insight and value around a topic that touches us in so many different ways. And especially since it is National Breast Cancer Awareness Month. So I am so honored to have Dr. Carol Laurie with me today, that we're going to dig in and get right into it, but welcome.
Oh, thank you for having me. I'm so excited to be here.
It's really the power of the internet, isn't it? And how you
Yes.
just connect and you make these incredible connections and you have these conversations. And this one is so timely. And that's why I wanted to rush this conversation. We just met recently and
Mhm.
I've seen Dr. Carol, I've seen Carol, I guess I should just call you Carol, on other things. And she's so passionate about what she does. And so we're going to dig right in. So let's just get started. You get this diagnosis. I have a mom who was diagnosed with breast cancer at 63, so postmenopausal. And I can remember at that point in my life coming home. I had my daughter at that point, and she said, "I have breast cancer." So let's just start there because those are four powerful words.
Very,
So,
very.
let's just walk through that and start sharing kind of your insight and your journey and how you've gotten to this point.
Well, 330,000 women this year will be diagnosed with some form of breast cancer, and they will hear the words, "You have breast cancer." And that in that moment, your life has dramatically changed, whether it's
Right.
you or as you experienced your mom or your daughter or your granddaughter or a dear friend.
Hmm.
Everyone knows someone who has breast cancer, and it's unfortunately increasing in statistics. And during this time of the pandemic, breast cancer is still with us. So I think
Right.
it's very important that we keep uh, facing that reality. And there is a lot that we can do as women to, one, decrease your risk of getting breast cancer in the first place.
Right.
But if you've
Right.
been diagnosed, how can we make the best out of this experience? Now,
Yeah.
I personally have not had breast cancer. My introduction to breast cancer was when my dear college friends heard those words, "You have breast cancer."
Right.
And
Right.
one morning I was with my family, the normal chaotic morning, getting ready for school and work, and the phone rang and I picked it up, and I thought it was a crank call because all I could hear was crying. And when
Right.
she was able to catch her breath, she said, "I have breast cancer.
Mm.
And will you come with me to the biopsy?" So that, of course, I said yes. That
Right.
was the beginning of 18 months of me going to every single biopsy, chemotherapy infusion, radiation, doctor's visits, which at UCSF is a 6-hour experience.
Wow. Sure.
So I got an up close and personal perspective of what is working in the medical profession, which is a lot.
Hmm.
And then the other side, which is what I address, of what can you do to prepare for your chemotherapy and how do you want to take care of yourself while you're going through treatment? And also, very importantly, what do you do after you've rung the bell?
Mm.
Because
Wow.
there's not enough follow up. And
Right.
there's a
Right.
big disconnect. One of the things I experienced is no less than 4 times during the infusion of my friend were we offered a hard candy, orange juice, a cookie, or a cupcake.
Mm. Mm.
Now, if women don't know this, there is something called the Warburg effect. And the
Mm.
Warburg effect was discovered by Otto Warburg in the 1931. He won the Nobel Medicine Peace Prize
Wow.
for realizing that cancer cells, given a choice between oxygen and sugar,
Mm.
will choose sugar for
Sugar.
their energy source, even though it provides them with less energy or ATP. That's
Wow.
how much sugar drives cancer. You
Wow.
don't want to be giving somebody sugar when a woman is getting chemotherapy, which is supposed to kill the cancer cells. It's
Right.
like it's huge disconnect.
Yeah.
And
Isn't that interesting? And so many
yes,
women are sugar driven. I mean, I'm
oh,
sorry.
the
I one
American
of those.
diet, the standard American diet,
Yes.
SAD, which is also dangerous, is
Right.
very sugar and carbohydrate processed food
Right.
driven. So
Exactly.
one of the first things I want to share with the community I work with and your audience is we all need to dramatically shift our diet.
Yeah.
If you
Yeah.
don't do anything else, if you divorce, that's a hard word, but that's the reality, the standard American diet, and
Right.
develop a more plant-based, organic
Yeah.
diet with
Healthier.
live foods, you will dramatically improve your risk for having a recurrence and
Mm.
decrease your chances of getting it in the first place if you have a family history of breast cancer.
Wow. Isn't that amazing? That, and that sounds like something we can all do. We obviously can all make changes to our diet and be healthier, but sometimes there is really a challenge around that, as you probably see with women. That's a big thing. Women get, we get stuck, we get fearful, we say, oh, and then we go back and we eat the sugar, or we do, that type of a thing. I just want to, before we talk about diet, I want to circle back to what you said at the beginning, and that was so important, because even though we're living in this pandemic, breast cancer is still happening, and all of these things. And my mammogram, for example, I was supposed to have in, June. It was postponed, and now it's rescheduled now. So I'm behind a few months, like so many
That's
women.
okay. That's okay. A few months hopefully is not going to
Right.
make a difference, but you don't want to say, oh, I'll skip it this year.
Exactly. And I think that's
That's
what women can do, because we get so busy with the other things. The appointment was maybe during lockdown or quarantine or whatever, and then it's on the back burner. So for everybody listening, what Carol said too, it's important for us to keep those appointments. Even if we're a few months off, it's still important to be seen this year. So I want to start by that. But let's talk about, when you had that incident, with your friend, and I have several friends, several that have passed away actually from breast cancer. When you are that friend, that anchor, that support for them, what advice can you give them to kind of help them nurture this journey that they're on?
Um, first of all, women shouldn't be putting themselves last.
Hmm.
That's one of the
Right.
big messages of breast
I know.
cancer. We
Yeah.
come first.
Right.
And I mean, that's a very big wake up call for women. So I want to really just reinforce, don't just say, oh, I have to take care of the rest of the family. I'll just
Right.
call and get your mammogram. That's number one.
Right.
But if you're an anchor friend,
Hmm.
assisting your dear friend going through breast cancer, one of the best things you can do is become educated,
Mm.
because that education that you have is going to reverberate through her care and treatment.
Right.
And for that, I created an online program in which I've taken all of my clinical experience and I've provided it to the internet, which is how
Right.
we met.
Right.
And it's called thepathofbreastcancer.com.
Mm.
So it's really made for women who are going through breast cancer. But if
Right.
you're a friend, the information in there is translatable, and
Right.
somebody can purchase this. It's not that expensive, and you
Right.
can just use this information to guide you through the breast cancer journey, which is how I formed it. I asked my community, what do you need to know? And
Right.
I then based this program on those answers to those very important questions.
Mm.
I think it's really important to get a few things down. If you're supporting someone through chemotherapy, you cannot eat a steak tonight and go to chemotherapy tomorrow and think you won't be sick.
There you
So
go.
I encourage women to use intermittent fasting or caloric reduction. And
Mm.
I talk all
Interesting.
about that in my program. And there's
Yeah.
scientific evidence that shows what happens when you
Right.
either fast or reduce your calories. And I'll just briefly explain this for your audience.
Mm.
When you go into fasting mode or
Hmm.
calorie restriction, you're reducing your calories by up to 50 or 70%, however much you can
Right.
tolerate. The cancer cells, they love sugar. So they
Mm.
go into, oh my goodness, I'm starving mode. And your healthy cells go into, oh my goodness, I'm going to put up a wall and protect myself mode. So when you go for that infusion, the cancer cells take up more of the chemotherapy and the healthy cells go into protection mode and they don't. So
Wow.
that really, first, it will increase the effectiveness of your chemotherapy. And second, you will have less side effects.
Mm. Side
So
effects. That's a big thing, isn't
the
it?
side effects are a big thing. So
Hmm.
any little tool that we can use that will reduce the side effects, even by, and each tool I think can add 10%. So if we do 3 tools and we reduce your side effects by 30%, and of
Wow.
course you're doing the medication that the oncology team gives you, you
Right.
can have a more positive experience. You don't have
Right.
to be throwing up and in the bathroom for 3 days after chemotherapy.
Right. Right. What are the biggest fears you see with, you know, women that come in and see you? What really are those things that just it's stopping them in their tracks?
Well, I call it the wake up in the middle of the night staring at the ceiling syndrome, because that's what happens.
Mm-hmm.
Women are busy during the day, and
Right.
then it all floods back at night when
Yeah.
the house is quiet, and they wake up and they're looking at the ceiling and their heart is beating, and they go, did the chemotherapy or the treatments work? What if it comes back? So
Right.
I recently asked my online community, what is your number one fear? And 90% of the women said, what if it comes back?
Right.
And that's what module 3, preventing recurrence, covers.
Mm,
So let
interesting.
me just briefly talk about that, because empowerment is knowledge, means decrease anxiety, and
Right.
you feel like you can do something, because there's
Exactly.
this you've rung the bell and now you're
You've
done
rung the bell.
syndrome.
Mm-hmm.
And that is misinformation. So you've rung the bell. First of all, the impact of radiation on your body can last up for 6 to 8 months. And radiation can create severe cognitive decline.
Right.
It can create more aggressive cancers on the opposite side. It creates a lot of oxidative stress. So you'll get a really impacted energy. And while you're in radiation, there's a few things that we can do, but after you're done radiation, we really want to do a lot, so you don't end up with some of these side effects. And that's where the nutrition and the targeted supplements come in. And
Mm,
this targeted supplements are science-based. It's not
right.
like you go and you look at the shelves and think, oh, this looks good or that looks good. Even with Dr. Google, it's very hard to
Dr.
put
Google.
together a protocol that
Right.
works. And to understand the subtlety of a targeted supplemental protocol takes years of study. So I really want to encourage women, and women can get extremely educated, but it's always a good idea to do a consultation with someone who specializes in integrative oncology, even if you only do one
Right.
consultation, to make sure that, one, you're on the right track, and two, the supplements that you're taking are made to pharmaceutical quality standards,
Mm,
because not all supplements are created equally.
right.
And a lot of them that are on the shelves, I would not personally recommend to my patients. And I have spent a lot of time making sure I visited a lot of the pharmaceutical manufacturing companies of products and companies that I recommend, and they make their supplements to pharmaceutical quality standards. I mean, it's
Right.
sterile, it's clean, they have research and development facilities. It's very scientifically based, and each single product has a label and a code. And if you want to know where it came from, there's third-party testing. It's just like a drug
Mm-hmm.
company. I mean,
Mm-hmm.
that's how intense and committed they are to the quality of their products.
Boy, that makes a big difference. Absolutely. You know, a lot of women, when they're diagnosed or they've gone through treatment or they've rung the bell, all of a sudden they say, I feel so alone. I feel very alone. What's some advice for those women that are feeling that way?
Thank you for bringing up, because I think that's a really important side effect that happens when you're
Mm-hmm.
in what I call active treatment and you're showing up for infusions or radiation every day. You feel like you're doing something,
Right.
and you do get a lot of support from showing up and being there, especially now when we're all somewhat isolated due to the pandemic. There's less contact with people, and then you've rung the bell and you don't feel well, and now what are you doing with your time?
Right.
So I think from the very beginning, you want to create a village around your support system. And I talk about that in module 1, which is treatment.
Mm-hmm.
It takes a village.
Mm,
And this is where your dear friend, who's like the head honcho here, is going
right.
to organize your colleagues, your friends, your religious groups to show up and support you with meals, with taking care of the kids, with being on a Zoom, tea meeting with a friend.
Right.
These really make a difference. And your emotional perspective and way of thinking about your breast cancer is equally important as the medical treatment that you get.
Mm,
And we all have these little voices in our head that
Absolutely.
sometimes don't serve us. And they come out in the middle of the night. They come out in the daytime. And the next thing you know, you're like very gloomy and thinking, oh, this is horrible. I'm going to get sick again. Who's going to take care of my family? I mean, it's what we want to do is really nourish your cells with positive healing foods and nourish your soul with your friends and connection. And so
Mm,
when you get into those dark places or complexes, the volume is not that big and they don't last that long.
right. Right. Oh, that's so interesting. That power of community, that power of positive. I did a talk recently, and I talked about just self affirmations and how you can't talk defeat and expect victory. And
Very good.
that's so important because she can't. So I had a guest on a podcast last year, and she had lost her husband, and she talked about her support group and those things that she really needed at that point. She gave us a few tips around
Great.
what to do to support that friend, and that was things like, if you're at Costco and you see a thing of strawberries, don't take the time to call her, just pick up those strawberries and bring them over. Are
As
those the
long as
types
they're
of things?
organic, as
As long
long
as
as
they're
they're
organic. There you
organic.
go. Yes, exactly.
No one wants to eat non-organic strawberries.
Right.
Strawberries are the number one vegetable which
Yeah.
absorb the most spray. So if you're eating
Oh, interesting.
non-organic strawberries, you're basically eating like a teaspoon or a tablespoon of toxic spray. So
Wow.
please, everyone, do not ever eat non-organic
Good
strawberries.
advice. Good
Yes,
advice.
I think that's
Good advice.
I think that's a great idea. I mean,
Yeah.
yes, if you're at Costco and you feel like you're, protected and safe,
Right.
pick up some toilet paper, paper
Take it
towels,
to them. Yeah.
eco laundry detergent,
Right.
anything that is, organic and you feel like they can use.
Right.
Gather some friends together and say, okay, everybody, let's cook a meal once a week. If 5 women, unfortunately, it's always usually women who do the cooking.
True. Very
But
true.
I don't want, maybe there's a man who cooks. I don't want to be
Exactly.
exclusive. If someone wants to gather, your friends and say, okay, everyone, let's cook one time for our friend this week, enough for the family for dinner, and there'll be leftovers for lunch the next day. And you need to just make sure you're aware of what she is or is not eating.
Right. Good
So if
advice.
she's not eating cheese, you don't want to bring over a lasagna, as
Yeah.
much as I love lasagna.
Right.
So
And
you
that is
want
an easy
to,
go-to. You
it
have
is.
most people listening probably have taken a lasagna to a friend in need at one point in
Right.
their life.
Or,
Yeah.
a pasta casserole with vegetables
Right.
and cheese in it. I mean, we need to be aware that women who are undergoing treatment have very different nutritional needs, and they may have adopted a different food way of eating
Right.
once they've become ill that is different than the way they used to. So the head woman who is being responsible for the friend
Hmm.
needs to inform everyone, okay, our friend is no longer eating gluten and dairy and
Right.
pasta, so we need to make soups, and we need to have steamed vegetables and maybe, some wild rice
Right.
and that kind of thing.
Yeah. What about women that have gone through treatment and now are going to be getting back to work? And what types of advice do you give those women that are ready to take that step? They're healthy enough, they feel good, they're ready to go back.
I think it's very important to restore your health and recover your life. And especially if you love your work. I mean, one of the main components of the trauma of breast cancer is that one minute you have your life, which we're all attached to,
Right.
and the next minute it's sort of like ripped away from you, and
Right.
you've lost everything, including your hair.
Hmm.
So I think first of all, we don't want to be a victim to this disease. And yes, no, of course, nobody wants this illness. But once we have this illness, and it is an illness, and it can become a chronic disease, which you manage with your medicines and your nutrition and your supplements and your healthy lifestyle changes. You want to really begin to embrace, okay, I have breast cancer. What's the messaging here?
Right.
Now, I don't feel like it's a war with breast cancer. I don't think we should conquer it. I don't think we should attack it, because those are all masculine
Mm.
approaches.
Hmm.
I
Hmm.
think I
Interesting.
have a more feminine perspective, which is, okay, I have breast cancer. I need to become quiet and do some conversations with my tumor
Mm-hmm.
and be open to what it says, no matter how strange or weird it is. And when you incorporate that side, in addition to the medicines and the lifestyle changes and the nutrition, you can get a very far out healing in ways that you didn't
Wow.
even think was possible.
That's the power
But
of the mind, right? That's the power
yes,
of the
it's
mind.
very, the mind and the body are very important. And
Mm-hmm.
unfortunately, the oncology component attends to the tumor, and my other side of treatment, which is equally important, both sides of the coin are equally important. We do the whole person. You're the host of the cancer. You're the hostess.
Yes.
Now, getting back to how do you get back to work? I think that you don't want to go back to work full time right
Right.
away if you have that option, because when we disconnect from our life of how busy we used to be, and that's another component of cancer, it drives busyness.
Mm,
It's very difficult to just return to the life as you had it. Your energy is shifted, your mind has shifted, and you're hopefully moving slower. So, as part of returning to work, maybe you can initially start half time and just
right.
work the mornings or the afternoons for a few weeks until you begin to get your rhythm.
Yeah,
And
it is really treating yourself. I say that we talked earlier about treating yourself, making yourself a priority. Treating yourself as a guest of honor is what I like to say. And that really is listening to yourself and listening to your body and knowing when you have to rest. And why is that, Carol? Why is that so challenging for women? Why do you
well,
find
it's
that?
a societal, this is a very important component. Society, messaging, advertising, which we get in our brains from a very young age from watching
Right.
television, that women should be acting like certain ways and we should be eating certain ways. And one of my favorite commercials, favorite in quotes, is this one where they're talking about an antidepressant. And of course, it's a woman who's depressed. And one minute she's sitting there, she hasn't showered, she looks horrible. And then she takes this antidepressant, and the next image is she's feeding the family in an outdoor picnic. What is the messaging there, ladies?
Right.
This makes me very upset. It's like,
Yeah.
why isn't the woman sitting down and the man serving the family? I mean,
Right.
where is the
Right.
messaging? So
Yeah.
when you watch commercials, start to look at it from how is America viewing women's roles?
Mm-hmm.
And this also goes to how we were raised for what is breakfast. Breakfast does not come in a box with, puff flakes in it.
Right.
Breakfast does not come in those frozen things. There's no live food in there, which you put in a toaster and
Right.
then you take it out and it has sugar and chemicals. That's not breakfast.
Right.
How are you
Right.
feeding yourselves with these horrible chemicals? And then,
Yeah.
you drink a frappy coffee drink that has more sugar. And then you wonder why, Americans have high levels of obesity,
Yeah.
hyperlipidemia, cholesterol problems, hypertension. I mean, we need to really become aware and open our eyes to what messaging we are getting from television. And the more you separate yourself from those messages and individuate your life to a life of health and
Mm-hmm.
nutrition and happiness and healthy lifestyle choices, the healthier you and your family will become across the board.
Yeah, exactly. And joy, just having joy and taking that time. I look at this now with this pandemic and a bit of a reset for a lot of people.
Yeah.
And it is true. We have to start honoring that and giving ourselves permission to take care of ourselves and treat ourselves with healthy foods and all of that. And that is such a big component of health issues as we age. I want to go back to, that friend that you were there for all of those treatments. Can you take me to a time just during that journey where you felt like, wow, I'm tired, I don't know what to do. Did you have those days where you just were like, gosh, I don't know if I can be there for her today? How did you step yourself out of that and become that, continue to embrace it positively?
Well, when I realized the enormity of what this was requiring, I then got a list of her friends,
Mm,
and I was the head organizer here,
right.
and I arranged for a different friend to come up and spend the week after chemotherapy with her. That's what I did, because I had a family of my own and my practice, and I
Right.
had put a lot of that on hold. But when I thought, oh, it's not going to be a big deal, but it was a big deal, and it took a lot of time. And there comes a time when, my husband was saying, "You're never home," and my daughter was saying, "Where are you?" And I had, like, let my practice put them on
Right.
hold. So I had to take charge and realize that I needed to get help. So I arranged for all of her different friends. The week after chemo, somebody showed up, and they were responsible for her care after that. And
Mm.
then when she was going through radiation, there were different people who took her at different times. So I wasn't the only person. And I think it's very important to realize that it's pretty much too much for one person to
Right.
be the head support person, because our culture has negative connotations to the word need, or
Mm.
needing, or needy.
Yep.
And
Exactly.
when a woman is going through breast cancer treatment, it's appropriate. There
Right.
is a decompensation, there is a regression, there is a physical and emotional need. And it's not possible for one person to fill all of that.
Exactly. Exactly. Right. Use your resources, reach out to
Mhm.
others. Yeah, amazing. Amazing. It's really, and you talk so much about this, cultivating the innate healing within you. And I really love that. That's really what your message is. It's a whole body approach to it. And it's a marathon, not a sprint.
It takes, it's a very different perspective, because it's not
Hmm.
a Band-Aid
Right.
approach.
Right.
And when a woman is feeling upset, I'm not one to say, get over it.
Right.
I think that leads to inflammation, and we really want to do everything to minimize stagnation and inflammation, emotionally and from a functional standpoint. So I really think that when you are upset, it's important to go into the pain as much as you can, and to
Hmm.
talk about it, and to really figure out why you're upset, and don't minimize it. I mean, I don't like it when a woman goes to a doctor and she's feeling depressed. And I saw this in when I was in the office with my friend. She was depressed. She was having hot flashes, and the nurse practitioner said, "Oh, let's just give you a prescription for Effexor." And
Yeah.
both of us said, "No."
No.
I mean, now we were educated, but if
Right.
a woman is not educated,
Right.
she'll be on Effexor, and it's a very difficult drug to get off of. It really impacts your brain biochemistry. So, and you can't just decide to stop taking it without there
Right.
being consequences and side
Sure.
effects. So before you add a drug for depression, and I'm not minimizing the impact of
Right.
treatment on depression and anxiety, do a consultation with an acupuncturist or someone like myself, and
Right.
find out what other natural alternatives can you get. Go into therapy
Hmm. Hmm.
and realize that,
Right.
I have a lot of emotions. I don't need a drug. I need to figure out what I'm not happy about with my life. And
Yes.
it's appropriate to be upset now. Not
Right.
all depression is inappropriate.
There's so much power in that, and asking for help. And there are so many great. No, I agree. And women are the last people to do that. We'll find
Right.
help for everybody else, for the rest of our family, our husbands, our whatever, and then for ourselves, that's always the biggest challenge, because it makes us feel as though we're weak. But I agree with you 100%. There are so many great options out there, resources to use, conversations to have with experts around this. So I appreciate you giving that viewpoint, because it is so important. Um, is there anything else you wanted to cover around breast cancer, or any other pearls of knowledge before I ask you my favorite question I ask on every podcast? But anything else you'd like to share, Dr. Lori?
Illness is not weakness. Emotions are not weakness. Um, Breast cancer is an opportunity for a woman to really become a different, healthier, happier version of yourself. And that's not an easy path. It can be the most difficult path, because the path of breast cancer is not only, chemo and radiation. Then there's, are you going to have a mastectomy or not?
Right.
Are you then going, after you ring the bell and you're out of treatment, what are you then doing? What integrative tools can you use to keep it from coming back? And they do make a difference.
Hmm.
How are the health of your bones and the side effects from your tamoxifen or aromatase inhibitors that you're on? And do you have an oncologist that is going to listen to you and not dismiss the fact that you can't move because you have such joint pain from these medications? Your
Mm-hmm.
quality of life is critically important.
Mm-hmm.
If you can't move because you're on such strong aromatase inhibitors or tamoxifen, your doctor needs to listen to you, and you need to get a lower dose or change the
Right.
dosing or do a consultation with an integrative oncology experts to find out what your options are. I
Right.
mean, quality of life is extremely important because
Right.
I want breast cancer to become a chronic disease after you're done active treatment. Just like, Hashimoto's thyroiditis is, you have to
Mm.
change your diet, you take a thyroid supplement, you support your autoimmune system. That's how I want breast cancer to become viewed as by the women I work with and in my online community. It can become a chronic disease. We can manage the driving factors emotionally, genetically, genomically.
Mm.
Um, it is an
Love that.
opportunity to get rid of stuff in your life that doesn't work. For example, I'm sure we all have friends where all they do is call you up and complain, and you're taking care of them.
Right. Oh yeah. Yeah. We
Women
talked a
like
lot about
that,
friends.
right?
Absolutely. Yeah.
Women like that are no longer, your psyche is no longer able to be nice to people like that. And,
Right.
notice I
Right.
said be nice, and women are taught to be nice. It's like
Yeah.
you
Yeah.
have to start really cleaning out the underwear drawer, literally and metaphorically, of situations in your life that don't serve your highest health.
Right. Right.
No more,
Exactly.
I'm on the back burner. Oh, it's okay. I'll just talk to this person for 20 minutes and get off feeling exhausted and toxic.
Right. 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 No, it's like a financial portfolio. You have to be investing, not withdrawing.
Yeah.
And that's so important. So important. So thank you so much. I know you work with women all over the country, all over the world. So I will attach all of that to the episode notes on the website, all of that. And you can get in touch with Carol, Dr. Lori, and ask her these questions and have those conversations. And she'll
I
guide you
have a
on a
free
journey.
gift. Yes. And
Oh,
I
you
have a
do.
free
Oh, there
gift
you
that I'll be
go.
sending you the information for too.
Oh, very nice. Oh, thank you for that. I
Hmm.
want to ask you one question. I ask everybody every time I have a guest, and I never get the same answer, so I'm excited to hear
Oh,
yours. If you
good.
were sitting on the couch and you look over and there you are at 30, what advice would you give that younger self?
Wow. Um,
I know
well, I'm
it's
a
no.
lot older than 30 now.
Me too.
And
Yep.
at 30, I was still in naturopathic medical school.
Mm,
I would say be kinder to yourself. Give yourself more acknowledgement and get in touch with the good things that are there and begin to really untangle and accept some of the more difficult parts of yourself. And we all have those in ourselves, but don't take them so seriously and work on loving yourself more.
mm,
And it's, we're all on a journey. And even though I'm 30 some years older than I was when I was at 30, it's still a process that I'm working on and enjoying and bringing my message every day to the world and showing up. That's important.
exactly. So powerful. Thank you. Thank you so much for this conversation. I appreciate it.
It's my honor and pleasure to be here.
All right. We'll be in touch.